Our questions were now open for our panel.
Yeah, so I have a question for each of you. It'll be just the question of what are your recommendations, but first just wanted to give a background on it. Um, so I definitely believe that each of you in your company have tools, have resources, knowledge that's needed in public health, and but there's a question of how to apply that. So, Sean, you mentioned, for example, you want public health to work with you. We're not working with you. That for a number of reasons, probably. But I think the what would be helpful is when people think about whether it's Hornet or Grindr or Google, I think researchers have gotten to learn about those companies and think the way to apply it is to buy ads on those platforms. And buying ads is expensive. Maybe they've tried doing it and had little success. Maybe they've had someone who's tried to set up an account and use it for outreach. But if you can each give recommendations with your platform on specifically thinking the use case of a small public health department with barely any resources, what would be the best way for them? One or two insights for how they could leverage your platform or work directly with you to have the most impact.
Sure, I'm happy to go first. So one is around the costs. We give away millions of ads all the time. I think the real issue to make a big impact is that if you look at the public health campaigns in general, a lot of money is spent, whether that's CDC doing billboards or what have you. But no one measures the outcome of any of this ever. Like it is done at the end, but it doesn't affect the future funding, and it's not agile. We know on day one of the campaign if that's a good campaign or not. And so we need to be agile the way a corporation is agile. And if your competition changes, you need that flexibility. So you can have a really great campaign that is run at a high level. And then to the question of regional centers, I don't really know that they are the ones that should be driving all it's a generic campaign. What they need to do is drive information about their availability and access. And I think that we can provide feedback on, look, everyone's looking for your resource at 8 p.m., but you're closed. We know that. We have that data. And so, I just think that this is an ongoing conversation and we can improve. And, we look at UX, user design elements, and public health has bad UX.
Can I push you to be more specific even with that? Because I think what I took from that was run advertisements, but are there specific insights or ways to do it?
Sure. There should be a large campaign that is really run in a normal way, the same way a fast food chain would run a campaign that really delivers results, and your campaigns suck. So they don't deliver results. I can give you a number. 16,000 people went, 60 million people clicked the link. But at the end of the day, unless we're connecting how many people went in and got an HIV test or how many people are positive, and we can do that. We do that for any normal company running an ad. The other thing about what else can be done, we did an integration with AIDS.gov where you could put in where to get your HIV test. And you'd say you want an HIV test. We would do it when it was your 6 months anniversary from your last HIV test, and it would send you the 10 closest clinics. But then the day, that's not actually the information the user wants. They want someone to say, hey, go to this place at 6 o'clock because no one's there and it's easy to get in. And so that's where I really think this way of building up peer systems inside the app is an effective thing. So I think there's a whole set of innovation that needs to get driven. And it doesn't matter if you took Grindr and Hornet and Scruffed and Blued and combined us all. We can't all drive that. I'm happy to. We have full-time people that work on that, but it's not gonna. We really have a huge opportunity here. We have a lot of gay people online, and we can really design much better ways for people to access health.
So what I'm hearing there, just clarify. So one is with ads, track conversion rates and benchmark them against success of other companies. It sounded like was the first one. And the second is integrate peer.
Agile real-time adjustments to ad campaigns.
And the last thing that I would just share from Grindr's side is I really can't overstate the importance of a partner like Building Healthy Online Communities. Just going back to what Dan said earlier, I believe that there is an opportunity that they specifically have in partnership with app owners to really educate about what kinds of ads have been successful so far. We've been working with community centers to do some A/B testing on chemsex messaging and party and play messaging. So, we've been able to kind of see from the back end which types of messages are resonating more than others. So we would definitely encourage that, particularly for community organizations. The one thing I will say is that, we offer outbreak advisories for as long as health departments need them at no cost. And our company is still currently working to figure out how we might be able to make ad buys more financially accessible for health departments. So those are the last pieces that I would share related to that.
So I wanted to ask if so there were these fields available on your apps, like the date in which you got last tested and your HIV status and so on. Sure. So I was wondering, can you check the veracity of those fields, or those are just self-reported? And kind of a related question is, can you see kind of the return to that, in the sense that if I'm saying I'm frequently testing myself, do I see that, there's more interest in my page or my profile? So that kind of there is, this private return to STI prevention or not?
Let me answer the first part around kind of the truthfulness of those. So some people have done that research, and we have additional modeling, so I can point that to you later. And then there's a communication science topic around this biomedical sorting. And so we see that behavior, and there's a forthcoming paper out of UCSD from Po Yao, who's just did a really great paper on this.
And from the Grindr side, HIV status and last tested data are all self-reported. As I said earlier, these are really user-driven. They were created in response to making conversations about sexual health easier. So in terms of any sort of kind of sorting action or seeing whose profile is more interested in another, that's not anything that we have at this time.
Just clarifying, that's just HIV though, right? It's not other STIs that have fields in your, just HIV?
So in Grindr, it's HIV, there's 4 options. So you can say that you're positive undetectable, that you're negative on PrEP, or that you're negative, or you can also just choose not to put it on your profile at all.
And how about for your app?
Yeah, that's the same. I'm curious what you would imagine for other STIs.
I don't know. I'm just, we're looking at other STI. I mean, our charge is broader than,
Well,
is not
that-
just HIV, or it's actually not HIV. So I'm just curious in terms of thinking about, are there other ways to provide information? That's
Yeah,
why.
I think the 99% of everything that comes across our desk is related to HIV because it's such a devastating disease. But, I think the lack of attention for general wellness education for LGBT people is a missed opportunity. And so when I said I think the fourth 90, the idea of the fourth 90 should be the first 90, I really mean that. We can look at entire sexual wellness and gay men's health, and that is a way to make that messaging more interesting. So if we're talking about relationship health or whatever, you can talk about having your commitment and sexual contract agreement with your partner or partners. And I just think that is the work that we should be doing. And we just really do this 1980s kind of public health approach to messaging.
So I'm interested in networks, and you mentioned that kind of the public health campaigns aren't that great, or they suck, and that sounds like it's kind of when I hear public health campaign, I hear like there's some sort of ad and whether people click on it or whatever. I mean, are there more advanced analytics so that you can identify someone who's well connected, or or a group that has a certain behavior or characteristic, and do more targeting like that? Is that the type of not ad, but sort of intervention, if you will, that you think is more of interest or more impactful?
Yeah, super excited to talk about that. There's a researcher in Taiwan who's a mathematician who really is looking at kind of the network math, and it's something that's super interesting to me. And I can't think of Vincent's last name at Rutgers, who's now leading the Urban Health Institute. But we've been talking to him about this possibility. Where I kind of saw one of the first, because there's going to be a limitation for privacy reasons and different things. But I think from an AI or machine learning perspective, you could do these kind of immediate interventions based on kind of a little bit of network math. And then I think from an epidemiology perspective, I think that's also possible. And I think especially around other things besides just STIs, like risk-taking and drug use, for example.
Yes, thank you so much for these presentations. So I was intrigued by this nexus between sort of the app users on the one hand and the providers on the other, and sort of the fact that providers are the availability and other sort of user issue on the provider side remains to be further developed, I suppose. But are there any models for this? Have you worked with providers that sort of give more sort of real-time information about their services to sort of get that nexus to be closer?
Yeah, so in Thailand, we're working with some really interesting folks, the Thai Red Cross, Love Foundation, Safe Clinic, around kind of, and FHI 360, around trying to, create interaction. Everyone always keeps building an app where you are working on adherence. You feed a bird a coin and you get it rewarded, and we keep building these apps. But at the end of the day, we shouldn't build any more apps. We should build APIs that connect each other, because all the users are on these apps, whether it's Hornet or Grindr or wherever. And we just need to make frictionless connections to know when there's an availability for them to get an HIV test. We could let people know that no one's waiting at this clinic right now and we have underutilized capacity. Or we could allow people to schedule an appointment when the appointment's not even open, to figure out when it should be opened, and maybe we could find on-demand ways to do that. So there was a GPS feature on AIDS.gov, and someone had a great idea there, but that was 10 years ago, and that thing's never been updated. And we could build that in like a week.
Jeff, if you need the mic.
Let's make Sean go first.
Oh, yes. Sean, I didn't. Okay. Sean?
So each of your companies have so much in putting privacy and ethical issues aside for a minute. Each of you have data, individual level data, which could address so many problems that exist in public health for prevention, treatment of STIs. Thoughts on, profile data, knowing who and where is at risk, who's at risk, where they are, what they're going to be doing. Google looking at having individual level search data that can track people down to a location. Thoughts on how this information might be used in collaboration with public health and the ethical concerns in addressing that it seems like there are a lot of answers there within the data. How do we use that information? Big question.
We see that we have users who want HIV services and you don't provide that to them. So we have the data, we see it, and we tell you this. So you want to read it again? We can publish it, but there are opportunities there, but I don't know how I scream to have people work on this, and I don't know what else to do there.
From Gartner for Equality's piece, this is a great question. I think that sometimes folks who aren't familiar on the app side, and I'm only speaking for our app itself, I think sometimes folks think that we can see a lot more than we actually can. So the way in which our app works is that messages between users, so messages that might include information about like what people are into or like what their safer sex practices are. Those are all stored on a local device, so they're not in a cloud system. There's no access to see the content of those messages. So really the only two pieces of information that folks are required to share to even open a Grindr account is to share an email address and to share their location. That's how Grindr works, through geolocation. So when it comes to kind of data that might be useful for public health, we haven't yet found anything that could truly kind of have an impact, maybe in the way that some public health officials think. I think what this necessitates is just kind of, again, like that broader education around how these apps function and how they function differently from each other, as well as kind of what those real ethical and privacy concerns are in relation to global data protection.
Yeah, I'm thinking that it's clear that the STD clinics or any other clinical services or facility, there's limitations in space, working hours, locations, all of that. It's clear that that is the case. And it seems that you have access to a population that is looking for searching for questions that can be directed to specific symptoms and search for testing, for example. And I'm thinking that maybe would this be a role for your company, sort of like a bridge between an individual's quest for some services that are not available right now, but then you can bridge them to online or mail order STI testing, and then bridge them with, when the results are available, then bridge them with the availability of services and providers and such like that. So whenever the person needs the service, which is right now, maybe they can access the service online by mail or whatever, and then that allows some time for then the system to catch up and provide the services for those cases that are maybe complicated, because some simple infections may even be treated with, again, male treatments.
Yeah, I think that would be brilliant to have these frictionless services, and I think we've done studies that show that this works. You can just look on NIH, and there's 5,000 person population studies. But really, what we need to do now is scale that idea, and that takes whether it's the local health organization or something on a more national level or regional level to kind of really push that and drive that. And then if there's missing pieces, there's got to be someone on the public health side willing to hear that and want to work on that, because we know we have these gay men, we know that they're getting STI infections, and where that missing link is would take like an iterative process to discover that. But I think on our side, we're definitely willing to help our users.
Thank the companies for coming and presenting. I don't know if there's a lot of other companies on the panel or the invited to speak. And it's interesting, over the decades of the public health response for STD controls, the involvement of companies has waxed and waned. And historically, with the first syphilis elimination effort in the late 1930s, there was tremendous corporate involvement, a lot of corporate social responsibility. And I was interested in kind of your thoughts as businessmen and business leaders, what you think your role is in corporate social responsibility. Folks from Hornet made it very clear they want people to come to them with money, happy to take their money and use their own ideas for implementation. But should we not expect, corporations to also put some resources into the problem and be partners? And how could we go about, engaging in a way that we might be able to realize this as a partnership instead of a, capitalistic transaction?
So I think you misheard us. We invest far more in this initiative. In fact, that we have staff members. Grindr has staff members. I think you really overestimate how much is asked of us versus, and not just for HIV, but we have LGBT film festivals and migrant law issues that we work on, and we're tiny teams, and all the public health problems are put on our backs. And I'd love to hire more people to work on this and scale my health ambassadors in Spanish and Vietnamese and lots of other languages. But, how many, am I going to pay for 100 staff, or do I partner with an NGO? And I wasn't asking for money for myself for you guys to come pay the ad campaign. I think your ad campaigns suck. You guys don't know what you're doing. You need to run a really large campaign that's iterative, that runs in a professional way, that is multivariant from day one, and the multivariant, you look at it in real time and change it tomorrow, just like you would do with your vaccine research. You can do this. So I'm not asking for you to come spend money with us. I'm asking that you run professional campaigns the way the pizza parlor around the corner runs the campaign. They get this data in real time and they change their ad in 10 minutes if it's not working.
And from my vantage point, our Grindr for Equality team, we're made up of activists that have caused good trouble all over the place for decades. And so when I think about the ways that we can move forward on this, really what I'll reiterate is at this moment, specifically for departments of health or governmental funded agencies, we are giving free ads as long as needed for STI-related outbreaks. And we work, and by we, I mean me, I usually work and walk each health department through, if they aren't familiar with Grindr, or queer people, who are we? What have we been messaged to time and time again that hasn't been effective? We get feedback from our users about the advisory. So for me, I definitely see this as a problem, or not even a problem, but as an opportunity that I had as an HIV organizer for a decade. Really for me, it's about noting where there have been shortcomings, either in people not talking to each other or money being spent in a way where it could have been spent better. What I'm interested in moving forward is really understanding that we are here to support, especially those public health emergencies. And I think the other piece that I will come back to and reiterate is that what I would love to see from big STI-focused organizations, governmental organizations, is really a focus on partnership with community leaders. We can't do anything that has anything of substance without the community's input, without community leadership from the beginning. And I will say that until I'm blue in the face and you put me in the ground. That has been far our most successful, engaging ways to reach folks has been we create friendships, we create long-lasting relationships with the activists that we work with, especially in places that don't often consider Grindr as a community partner. And we also work with activists and organizations that typically wouldn't be working with a for-profit company. All of that has to do with trust. It's about building the one-on-one relationship. It's also about being transparent about what we do and what we don't have, and what we really realistically can offer moving forward. And I just even appreciate the time to be able to start this conversation that I'm sure is a long time coming.
So on that note, I want to say thank you to our panelists. Thank you for your thoughtful remarks and for your time. Thank you.
Thank you.
We have one more minute of business for our committee. This is now a public comment period, which I think is a part of our requirement. So is there anyone in the room who would like to make a comment on today's presentation or comments relevant to our statement of tasks are invited to do so now. Those attending the meeting virtually may submit comments electronically to stiprevention@nes.edu, and staff will read them aloud, so please keep your comments brief. You may submit additional comments to the committee after the meeting as well. So we want to have an opportunity, a minute or two, for any comments or responses.
So far we don't.
We're going to say thank you to our speakers today. Our entire committee, I think we could safely say that we appreciate your work and what you've provided for us today. If you have comments or questions, you could communicate with Amy at any time, who's our study director. So please keep in mind that any material that you wish to share with the committee will be made public through the project's public access file, which must be done because of the National Academies comply with Section 15 of the Federal Advisory Committee Act. With that, I'm going to say this meeting is adjourned. Thank you, everybody.
Thank you.